Go watch that video. Go watch all of that video and then tell me again, you chuckle fuck amoebas, that we should privatize healthcare in Canada, you dumb f***.
The type of video that pisses me off. He's blaming California for giving people without insurance discounts on these outrageous ambulance bills because he has insurance. So he's blaming the social program for the poor people instead of blaming his insurance company for not covering his bill more. Stop attacking poor people. Attack the corporation that you're paying for that's fucking you over. It's not the California law for the discount to help people who can't afford healthcare in this country. It's your insurance company. Fuck.
This is exactly why I tell everybody that the American healthcare system, the insurance system, is the biggest Ponzi scheme that has ever been perpetrated on the American public. I see it all day, every day, and this, while horrible, is sadly the tip of the iceberg. You are paying for thousands and thousands of dollars worth of insurance, and you're getting very little service as a result. Because you got to remember, insurance companies answer to shareholders, not patients. So you're never going to be their priority.
Let's start from the beginning. Let's start from the beginning, right?
How can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
No, this is just a new law that started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir. You should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
Welcome back to Sparkle's show. Hope you are all doing great. Thanks for all the love towards this channel. Today, we're covering yet another shocking FAFO moment that has Americans talking. A California dad recently shared his experience of being penalized for having health insurance, and let's just say, reactions have been pouring in from all sides. Before we get into it, we want to give full credit to the original creators and Stitches who have shared their personal stories and breakdowns of this issue. Their firsthand experiences and analyses have sparked important conversations, and we encourage you to check them out for more insight. Now, let's unpack what's happening here after the end of the video for more commentary.
Go watch that video if you haven't seen it. But I'm experiencing something similar. If you don't know, I have a ton of health problems that started about 2 years ago from long COVID. And the beginning of this year, in January, when our policy renewed with the exact same insurance, nothing changed, my medication costs went up drastically. For example, I have one medication that is an over-the-counter medication that you can get over the counter, but my doctor says that the one that you get like from a prescription is like a little bit better quality, and it's actually cheaper before to get it through my insurance. The over-the-counter medication, if I get the generic one, is about $13 or so, $14 for a bottle. That should last a couple months. To get it now through my insurance, it is $75 for the exact same thing that used to be, it was like $1 before. Like it would cost me like $1 like 2 months ago, like before the new year started. Besides that, they have completely stopped covering for some reason a lot of my doctor's visits. So now instead of, getting what I was before, which is not, my plan has not changed at all. They've just stopped covering things randomly. They've said that, I've had enough, tests and enough doctor's visits and I don't need them anymore, even though my doctors are like, you very much need them. I was in physical therapy for like 2 years. I can't go to any of that shit anymore. I can't afford it. Because I can't work full time anymore because of what has happened to me. But yeah, they're not covering shit anymore. I don't know what happened. And not that having insurance before was great, but I guess it was better than being uninsured. But now, yeah, it's literally costing me more to use the insurance.
Situation, kind of because that guy lied to you. It is not that uninsured people in California are getting a discount that means they're only being charged $600 for the same ambulance ride that you got. What has happened is, in California, the state government approached healthcare providers and said, this is the number of dollars you are allowed to charge people that don't have legal representation. Because that is quite literally the majority of what an insurance company is. When you get insurance, what that insurance company does is it goes to healthcare providers and it says to them, we will allow you to charge this number of dollars to all of the people in this particular group for all of these particular services. Of those amounts, we will guarantee payment of this percentage of that amount. Agree or disagree. And then they sign a fucking contract, and that is the bill that you get when you have insurance and you go to that particular healthcare provider. Now, that healthcare provider knows that there is a large percentage of the population that even if they have insurance, they are going to struggle to pay that difference. So what do? They charge you an astronomical amount of money above and beyond what the insurance company has already paid them because they agreed to let them do that. And then when you don't pay it or you can't pay it, they sell it to a debt collector who then pays them to buy your debt. They're not going to get what you owe them dollar for dollar. Most of the time, they get like a half a penny all the way up to a nickel per dollar when they sell your debt to a debt collector. But this ensures that they are going to recoup an astronomical amount of money for a thing that didn't cost anywhere near that much. You have shitty representation. Be mad about that. Your insurance company agreed to the price that they are charging you. They negotiated that for you, and they did a shit job. It isn't higher for you because uninsured people are paying $600. It's higher for you because your insurance company agreed that's how much you should be able to pay. You, sir, are mad at the wrong people. Be mad at the medical industrial complex. Be mad at the pharmaceutical industrial complex. Be mad at the insurance industrial complex. And be mad at the federal government for not doing for everyone what California did for their uninsured. I hope you learned something. Have a great night.
My literal 20th time I've made this video. Go watch The Robbie Show. He's an actual fucking lawyer dealing with this nonsense over insurance in the state of California with an ambulance ride. So his bill goes from $600 to $1,300 because they realized that the insurance wasn't included on the ambulance ride. And then he got a bill making it 210% more expensive. It went from $600 to $1,300. I've gotten strep throat 3 times in the last 8.5 years. I go to HEB. I live here in Austin, Texas. Lordy, HEB. Hear about our butts. When they think I have insurance, it's $35. When I say I don't, I always pay $12. Why?
You should go watch that TikTok. I'm waving a magical wand over America to end all the corruption that's going on over there. Oh my gosh. So this guy got a bill for $600 for an ambulance ride for his daughter. And when he sent it back in, he gave his insurance information. And when it came back, he owed $1,300. How does that work out? When are people going to actually stand up and rise together? Ain't nothing going to happen when we're all just sitting on our asses doing nothing. TikToks like this should make you irate. Yeah.
I think the most egregious part of that whole thing is that the cash price is less not only than what he has to now pay because he has insurance, but they've already gotten more than what the cash price was from the insurance. And now they're looking for more than that, more than what the insurance gave him from him. Like, where does that make sense? And that's with insurance. Like, why are we even paying for insurance if the cost with insurance is going to be $400 more? And why does the doctor's office get to make out like a bandit? Because $900 if it's cash, $1,100 from the insurance company, plus $1,300 from the person if it's insurance.
What happened? So, here's the situation. A father in California thought he was doing the right thing by ensuring his family had health insurance, but instead of being rewarded, he was hit with a financial penalty. This left many Americans scratching their heads and questioning how something like this could happen in a system designed to promote coverage. Some key takeaways from his story. He paid for health insurance, but was still fined due to a technicality. Bureaucratic red tape made it difficult to resolve the issue. Many people in similar situations are now wondering if they could face the same problem. This situation has opened the floodgates for debates on healthcare policies, government regulations, and how these issues impact everyday Americans. The FAFO effect. Americans react as you'd expect. Reactions to this case have been mixed and intense. Some say this is proof that the system is broken. Critics argue that a system meant to provide affordable health care shouldn't be penalizing people who are trying to do the right thing. They believe excessive regulations and complicated policies are hurting working families. Others point to missing details. Some are questioning whether there was a misunderstanding about the law. They argue that government assistance programs have guidelines and mistakes can happen. Then there are those calling for change. Many Americans are now discussing the need for better policies that don't punish responsible behavior. Some believe this is an example of how FAFO applies beyond politics. People are finding out how policies they supported or ignored are affecting them directly. Is this an isolated incident or a bigger issue? This raises a bigger question. Is this a one-time mistake, or is it part of a larger problem? Some believe this is a rare case. They argue that most insured Americans don't face these issues. If mistakes happen, they can often be corrected with the right documentation. Others say this is part of a larger, flawed system. Many Americans have reported facing high premiums, surprise medical bills, and confusing insurance policies. They believe there's a deeper issue in how the healthcare system is structured. No matter where people stand on this, one thing is clear. This story has sparked major discussions about how healthcare policies are being implemented and whether they actually serve the people they're supposed to help. Moving forward, what can be done? Now that this story has gained traction, what should happen next? Policy reform? Should lawmakers step in to fix loopholes and prevent penalties like this? Are there ways to simplify healthcare regulations so families don't get caught in bureaucratic traps? More awareness? Do people need to be better informed about how healthcare laws work? Should there be more transparency in how insurance requirements are enforced? Or is this just how the system works? Some believe that government policies, by nature, come with complexities. Is it possible to create a truly fair and effective system? Or will there always be cases like this? These are the kinds of questions Americans are grappling with as they watch this story unfold. So, what do you think? Should this California dad's case be considered a wake-up call for healthcare reform? Or is this just an unfortunate one-time mistake? Let's get the conversation going. Drop your thoughts in the comments. Do you think healthcare policies are failing Americans, or is this just an example of someone not fully understanding the system? If you enjoyed today's discussion, don't forget to like, share, and subscribe to Sparkle's show for more real conversations on current events. Stay informed, stay engaged, and as always, we'll catch you next time.